Good afternoon and welcome all to today's session on cancer screening in women. To speak on the topic, we would like to welcome Dr. Mahati Reddy, our in-house senior consultant, obstetrics and gynecology. She has completed her studies in MBBS, MD, DG, and FICOG. We welcome you, Doctor. Kindly take over the session.
Yeah, very good afternoon, Smriti. Thanks for the introduction. Today, well, everyone must be wondering why I'm talking about the cancer screening. But most of the people that are talking about COVID. COVID is not a very rampant condition right now. It may affect pregnant people and others, but very minimum things which we have to do in COVID. So I thought cancer screening will be more ideal at this juncture. Talk about it, how to go about with the screening, what are the conditions where we screen, when do we screen, what structures do we screen. All these I'm going to talk in short so that at the end of the session, if you have any queries, I can discuss about it. Is screening of an organ before it develops into a full blown cancer. It's for people who have no symptoms, but still you screen that area. You visualize that area, do certain procedures, and identify the cancer in them. And the goal of the cancer screening is to reduce the number of people who develop and die from cancer. The aim is to detect cancer before the symptoms appear, either before the cancer, or early stage of cancer, which are treatable. So, what are the various cancers which we are going to discuss about? In India, most common cancer is cervical cancer. Before they used to say it's only cervical cancer, but now we are talking about other cancers like breast cancer too, which is highest now. When we talk about cancers in women, it's the breast cancer and cervical cancer. Then comes the other cancers like endometrial, ovarian, and all. So, what is the ideal screening program? See, every test can't be ideal. When do we call it ideal? It should be the cancer itself should be a major health problem, and it should be more treatable if detected early, and the test should be approachable, inexpensive, cost effective, means controlling this cancer with this cancer screening method, which should not be too high in expenses, and it should be affordable to all people of our country. So, what are the cancers next which we are going to talk about? Cervical cancer is the most common cancer, but what are the various methods of screening? How do you screen? When do you screen? What age onwards you screen? Starting from what age till what age? What methods are ideal? And when you stop screening, also we should know. Unless we know all this, we cannot decide for ourselves what are the screening methods we need to follow. So, first, talking about the cervical cancer, most of us know about the cervical cancer because we'll be talking about pap smear. Pap smear, what is pap smear? Pap smear is nothing but with just clinical examination, we take few cells from the cervix. What is cervix? Cervix is the mouth of the uterine organ, which can be accessible through a simple examination techniques. It's not an invasive procedure, it's a simple procedure where we take the cells from the surface by just smoothing it round with a small stick, and we dip them into certain liquid, and we get the cells cells from the surface. From here, we can analyze them, detect the abnormality, whether it is a precancerous lesion or early cancerous lesion, or, or even sorry, human papilloma virus infection, that is HPV. HPV you're aware of because HPV vaccines we give. When we give HPV vaccine, we are treating these uh, people with preventing them from HPV infection before it sets into the body beyond 9 years to 14 years, and next target group is 15 to 26 years. We give this vaccine to prevent this infection entering into the cervix, which may proceed to the precancerous lesion. Not all HPV infections proceed to cancer, but a small percentage do go in for precancerous lesion, and all these precancerous lesions do have HPV infection. So prevention at that stage with this vaccine is possible, and detection by pap smear. Pap smear is the ideal method. Liquid-based cytology or just a stick method which we do nowadays. Liquid-based cytology is the most common method which we are doing, detecting these early precancerous, that is before the actual cancer sets in. There's certain stages which take around 10 years to develop into a true cancer. Hence, detecting them 10 years early, treating them with a simpler procedure is ideal. Hence, screening these cervical cancers with this simple method is ideal, cost effective, reduces the mortality, morbidity. Hence, it benefits the individuals and the country. In this smear is generally taken from the transformation zone, which we talk about in the cervix, that is junction between the active external and internal cervix. That's the site where cancer starts. So we take the smear from that area, analyze them, and go accordingly. Now, talking about this is the cervical cancer screening. The method, as I told you, is the pap smear, which we commonly call it as. And there's another method too, by visualizing this transformation zone by a microscope. The enlarged picture of these cells are seen in this telescopic microscopic view, where we'll see where the abnormality is and take a biopsy. That's the second method, which is slightly costlier, but in suspected cases, even that is a good screening method. Then, when do you start doing cancer screening? See, in our country, we start from 30 years, 30 to 65 years, we start doing pap smear and or HPV testing. As pap smear is comparatively cheaper, easier, available throughout our country, we do that. Every 3 years we have to do. It's not that suppose we do now and this is normal pap smear, it's not over. Every 3 years we have to repeat it till the age of 65, because beyond that there's no scope for further converting them into abnormal areas. So 30 to 65 years, but American society, they start from age of 25 years. Below 25, the chances of developing cancer or precancerous lesions are rare. So time we are talking about from 25 or 30 years as in our country till 65 years. If it's pap smear, every 3 years. But if HPV testing, HPV DNA testing is also available even in our country, if we do that primary testing, it's every 5 years. That is, HPV with pap smear should be done every 5 years. Only pap smeared, it is every 3 years. So I think it's clear about the cervical cancers. And these simple precancerous lesions can be treated by simple methods. under local anesthesia too, as an outpatient procedure. Not only the screening technique is done in outpatient department, but even the minor procedures which we do after detecting precancerous lesion, the procedures are done as a outpatient simple procedures. So next, what is the other one which we are talking about? Cervical cancer is one which is rampant in our country, starting from very early age and goes up to 65. Next, breast cancer is also on rise. High incidence of breast cancer, which we are seeing in our country too. Previously, we would say breast cancer, oh, it's a small thing. This breast cancer is seen even in our country. The, both the groups, more commonly in the elite group, which we see these cancers occurring even in an early age, around 40s. Sometimes we see at an early age. But most of the breast cancers are seen beyond 40, 50 years. Hence, the importance of screening breast cancers is only after 45. But who are high risk group, whose mother's got a cancer or a family member has cancer in such group, we give them a chance to undergo mammogram. Mammogram is the technique of screening breast cancers. Other year, you have to get a mammogram in these women. Then 55 to 65, mammogram every 2 years of screening. 45 to 55 in few high risk, we advise for even yearly mammogram. But 55 and society and WHO also advises screening by mammogram, which is a simple X-ray technique. And sometimes in high risk group we combine with an MRI. But basic is mammogram. It's nothing but an X-ray. It's not a really complicated technique. It's a simple one. Little pressure effect pain may be uh, experienced during the mammogram, but it's not a very bad method, a painful method for you to undergo. So it's better people undergo screening with mammogram. And especially after 65 too. If the survival is 10 years or more, it's better they undergo mammogram beyond 65 years. Why we are talking about mammogram so much in our country now? Previously, the breast cancer was not so high, awareness was not so high, and the incidence is also high nowadays. Hence, we are advising mammogram. Even before mammogram, we can advise clinical breast examination. Clinical breast examination, it's something like a clinician examining whether there is any growth within the breast tissue. And once they find any abnormality, they send them for biopsies or higher screening methods. This can be done yearly. Clinical breast examination is a breast examination done by a clinician to examine to see if there's any growth or mass in the breast. Don't shy away from the clinical breast examination or mammogram. And these should be an opportunistic screening methods. Nowadays, even pap smear, people don't come easily without any symptoms. They say, I have, but when they come with mind, we take it as an opportunistic screening and screen these women clinically plus screen breast examination, and pap smear only by simple clinical examination, or the cervix by speculum examination as an outpatient procedure. So don't avoid the screening methods. Don't run away or shy away from these screening methods where you can detect them early. Previously, people, the survival was low. After menopause, they would say, "Oh, what do we have now? Why should we keep complaining about all these? We have already gone into menopause." And they would say, "Hardly we survive now after this." No, that's not so. Because even after menopause, the survival of a woman is one third in her menopausal age group. So treat the menopause as a condition, identify any problems in them, treat the hormonal symptoms, abnormal symptoms, including the breast screening, cervical screening, and even endometrial screening. Previously, we wouldn't do much about the screening methods, but once the hormone support is lost and the woman is feeling hot flushes or uneasiness, the vaginal dryness, urinary symptoms, all these are so high. So we have to give them hormonal treatment. So before giving hormonal treatment, we do the screening methods for breast, cervix, and even endometrium. That is simple ultrasound, transvaginal ultrasound, by which we see for the thickness of these endometrium. If the thickness is normal, low, then we keep them hormones. But if it's high, again, this is a screening method where we take a biopsy. So these are the simple screening methods. Cancers with the menopause screening. Menopause package with this cancer screening package, which is affordable, and it should reach to the remote person in our country. That's the whole idea of screening. Talking about cancer screening, availability of the test, where, and the message should reach to all that cancer screening is available everywhere, and it's not always expensive, even in the high corporate hospitals. So I do advise cancer screening to prevent cancers, detect them in early stage, which are at treatable stage, and survival is well another 10 to 15 years without any symptoms if it's treated, if they're caught at a very early age. We catch them before they become spread to the entire body. Now, let me answer any queries which you have. At what age should women start regularly screening themselves for cancer? I think I told about this. 30 years in our country, we start with pap smear. And beyond 45 years, and certain people, high risk group 45, otherwise 50 years for breast cancer screening. And endometrial screening will start at the stage of menopause. This is the age of screening, starting with. And for pap smear, every 3 years. HPV and PAP together every 5 years. Breast screening initially 45 to 55 every year in high school, and 55 to 65 we do every 2 years. This is the ideal method. The age is as early as 30 for the cervical cancer and 45 to 50 for breast cancer. Next, what is the earliest stage at which cancer can be detected and how? Uh, Earliest stage, that is, before even the cancer develops. There are certain stages, we call it precancerous, before cancer develops. As I showed you, these precancerous lesions develop much early, and which take 10 years to develop into a rampant cancer. So imagine you have a long duration, 10 years time. If you detect at a very early stage, precancerous or HPV detection, all these are done at a very early stage where these are treatable by simple methods. Precancerous lesions we treat as an outpatient procedure. Simple technique of cryo, cautery, or just cutting the superficial layer of the cervix. These are simple procedures which can be done in a very short time period and outpatient. Now, can cancer be detected even if we don't show any symptoms? That is the whole idea. The idea of screening. Screening itself indicates that it the tests are done in people who do not have symptoms. You're identifying them where they do not have any symptoms. Generally, people, as I told you, opportunistic screening. That is, they come with some other minor problem, little irregular bleeding, or white discharge, or infertility. Any of these conditions, we take it as an opportunity and we screen them. That's why we call it screening, not diagnosis, but screening them for cancer when they don't have symptoms. Then next, can cancer be detected? Okay. How common is breast cancer among women and what causes it? Okay, that's a good question. What the it is common in India. As I told you, as I discussed in the initial stages of the discussion, that previously we would say breast cancer is not so common in India. It's the cervical cancer. But now breast cancer is the commonest cancer in the Indian women too. So hence the importance of screening these women, and they can be detected early stage with clinical examination. That is, when they come for any other reason, the breast can be examined to rule out any growths, lumps, discharge, or any abnormality which a clinician will understand. Therefore, previously we would say even the self breast examination can make come. But by lot of studies where they're done, self breast examination, people are not able to identify, they're not able to detect uh, these lumps or abnormality. Hence, the role of self breast examination is not much. We are talking more about the clinical breast examination, mammogram, and higher investigations which are available now for very high risk women too. So mm, it's among common among women, and suppose there's a breast cancer in the family, then the risk of breast cancer uh, to suppose it's seen in mother, the daughter having chances of having breast cancer is high. This is genetically transmitted. So high, these are high risk women, obese women, late menopause, heavy breast. All these are the conditions where they are prone for breast cancers. And these such women who have a family history of breast cancer should be screened more often, started earlier. And one more antigen test, which is not so commonly done in our country, but American Society advised about Angelina Jolie, who had BRCA positive, so she got her mastectomy and all that done. Even her uterus, all these organs were, ovaries were removed as she was positive for BRCA. We call it BRCA 1 and 2, where it's if it's positive in a breast cancer woman, the immediate family members should get their BRCA antigen done. This is available in our country, and once that is positive, it's not only about just the breast cancer where we screen more carefully, it's also other organs, internal organs, which we have to identify, detect, and even to the extent of some, once they finish the family, we do hysterectomy with bilateral salpingo-oophorectomy. That is, uterus with both the ovaries are also removed in these women once they complete their family, when they are BRCA positive, because that high incidence of early onset of breast cancers and ovarian cancers are seen in these women. So, apart from the mammogram, BRCA, BRAC, BRCA1, BRCA2 antigens. I know people in my family members too, and in Indians who have BRCA positive. Hence, the importance of testing for BRCA if you can afford it. The costs have come down drastically even in India, so we can do BRCA testing as a screening tool too for high-risk women with breast cancer whose relatives have breast cancer with BRCA antigen positive. So, and of course, too tight bras and certain surgeries, the risk is high where we screen them too. So these are the people who chances of getting breast cancer is high. What are the questions being solved? What is the probability of being affected by cancer again after recovery? Once the cancer sets in, we should know what type of cancer, what is the stage of cancer, what type of treatment has been given. The recurrence rate for each cancers differ. So we are not talking about the cancer and recurrence. That will be based on individual cancers, what type of cancer treatments and all, and the oncosurgeon, the oncologist who have treated you, will explain about the recurrence. Then, what is the probability of being affected by cancer? Okay. Is infertility a symptom of cervical cancer? I don't say infertility a symptom of cervical cancer. Cervical cancer, other symptoms are there. It's not cervical cancer. Rarely you detect cervical cancer in infertility. It's the other cancers which are more common in them, and cervical cancer, of course, it occurs in younger people, but symptoms are different, and it's not so common because infertility we go in for more anovulatory type of conditions, high estrogenic, endometrial cancers, fibroids. All these are more common in infertility, but not cervical cancer. Probably you're asking me about the endometrial cancer. Yes, endometrial cancer is high in people who have infertility because of lack of ovum release and ovulatory condition where it is hyperestrogenic condition. But whereas cervical cancer, the pathogenesis itself is different. It, suppose the patient has PID, pelvic infection, because of that the infertility is there. Promiscuity is more, multiple sexual partners are more. In such situations, the chances of cervical cancer is high, but not infertility due to any other cause. It's PID, pelvic infections, and other. Does wearing bra while sleeping cause breast cancer? Yeah, not exactly cancer with just wearing a bra, but too tight bras should be avoided. Breast compression to underwire bras, which cause trauma, constant stimulation. These are the problems, not because just wearing a comfortable one, but it's the underwired bras which should be avoided. And of course, even these bras should not be worn continuously overnight, especially when they are too tight. Does food habits play any role in caries? uh, have a role in dietary diet intake. Like foods rich in fat, obesity, interrelated to hypertension, diabetes, all these are interconnected, and chances of having endometrial cancers are high. Even breast cancer is high in obese women. So, of course, diet discussion must have been done a lot of times. Diet plays a very important role, especially in the menopausal women or young adolescent women, PCO. Suppose they have polycystic ovaries. These polycystic ovaries going for diabetes, obesity, interrelated to certain changes in the breast because of the fat and endometrium. Both these cancers are also high. And once a woman has breast cancer, the chances of having even colon cancer. We are not aware of this, but colon cancer screening is very high in Western world, where the fiber high they don't take in high fiber diet. It's more fatty diet, non-vegetarian diet, and bowel disturbances. All these things they make them prone for colon cancer, and colon cancer screening is more in Western world. Whereas in our country, we have high fiber diet, and cancer colon is also not so high, so we don't advise regular colon screening. But still, people who have constipation or who are high fatty diet intaker, taking a high fatty non-vegetarian diet, in such people we need to do a colon screening, either endoscopy or certain ultrasound techniques. Polyps are common in them, so such things can be detected through endoscopy. So food plays an important role. Any condition, food plays a very important role. Hence, we need to check our diet. Like it's not only the fat, it's not only the oils, it's also the fiber which we take is very important. A lot of fruits in our diet. When we have a lot of fruits, the fiber is there, the sugars are maintained well, other complications of constipation and all these are reduced, and fat intake is also reduced. Hence, the cancer incidence is reduced with lot of fruits and vegetables in our diet, which have high fiber and antioxidants. So everything, anything you ask for, diet plays an important role.